Welcome back to AM Northwest. If you have a fear of the dentist, our next guest wants to put those fears to rest. Here to tell us about Sleep Dentistry Defined, his philosophy. We welcome back Dr. Heath Lampee. Good to see you again.
You too, Helen. Thanks so much.
So you've told us over the times that you've been here that there are people who put off going to the dentist because they have a fear of the dentist.
I would say at least half of the population has a dread or a fear of going to the dentist. And what I found in the last 9 years of practice is that it's my job to take this dread, this fear, and basically make it all right. That's my job, is to make dentistry all right and actually a somewhat of a pleasant experience.
So how do you take the fear out?
Well, we know that dentistry isn't very comfortable. You know, you have to get these tiny little tools in there. You have to be numb. You have to be pain-free. And so the way that we take the fear out is from the moment that you talk to my staff or get on our website, where you're going to have somebody that actually listens and actually kind of explain the process. Because a lot of the things in life that scare us the most are the things we don't see and don't understand. But if you can actually let somebody know that this is how this procedure needs to be done, this is how long it's going to take, this is how we're going to make you comfortable, and they can actually see the process and procedure, that they understand it, they're going to be better, and a lot of the fear is gone. And so, of course, the explanation helps, but also for patients that are, highly fearful, we can use our sedatives, our sleep dentistry, which is our sedation. And so that makes it so appointments go by in the blink of an eye, they don't really remember anything, they wake up and their dentistry is done.
Wow, and even when people come into your doors, it's a relaxing environment, isn't it?
Yeah, I've tried to figure out how do I make it from the moment somebody opens that front door to make it seem like they're just in a nice, comfortable hotel lobby or something like that. We've got a baby grand piano in there. We've got full-size candy bars. We've got nice flowers.
Now, the candy bars, I'm not quite understanding. That doesn't quite make sense to me since you're a dentist and you want people to avoid candy, but you want to make people happy.
Life is all about balance, right?
Okay, sure. Very true. Very true.
Just make sure you brush afterwards.
Yeah, exactly.
But it's also like after treatment, we have hot towels. We've got aromatherapy. It's these nice little things that most people don't think about, but it makes it comfortable. It makes it nice.
Tell us a little about the X-ray machine, the 3D scan.
So we bought a 3D X-ray, a CAT scan, about 6 years ago. And what it's allowed us to do is to plan our implant cases before we do them in real life. And also we plan root canals and stuff with it. So we're actually able to see the nerves better, the bone better. It actually shows dental infections better than traditional two-dimensional X-rays.
Wow.
And all of a sudden we take a 3D scan and we can see stuff that most people can't see with their regular X-rays. It's really cool.
And it's important to you, too, that people see the same doctor every time.
Continuity of care is really important. You're going to get me every time. And for the last 9 years, all I've done is do really hard, challenging work so that I have become very good at it. But also, at least twice a month, I'm going all over the country, going to some of the most advanced education centers to learn and become better and better and better, because this type of dentistry, we want people to be comfortable, but we also need their dentistry to be done really well.
Right.
And a lot of my patients need really complex work, and it needs to be done to perfection.
You're also big on making sure that people know there's no judgment.
That's big. A lot of my patients they've been shamed in the past when they go to dental offices for, people haven't been in 10 years. Maybe they have gum disease. Maybe they have a mouthful of cavities. And other dentists have made them feel bad about this. But, when somebody comes in and, their mouth isn't doing that well, we just say, we can handle this. This is no big deal. This is what I do on a daily basis. There's no need to be ashamed.
And ultimately, you want them to leave with a better smile and they're healthier.
Yes. One of my favorite things now is when we reconstruct somebody's mouth and get out all the infection that's been kind of latent and dormant in there for years, not only do they look better, they smile better, but their whole health is different and better. They feel like new people. And that's one of the most rewarding parts of my job, that they didn't teach us that in school at all.
Right.
And it's something that we've really found out just doing it in real life.
All right. Interesting. Great philosophy. You want folks, if they'd like to find out more about Sleep Dentistry Defined, the phone number is 503-646-2273. We'll put all that information on our website at KATU.com. Doctor, good to see you again.